Hi, thank you so much for taking the time to speak with us. Could I get your first and last name and your title?
Sure. I'm Valerie Gutmann Koch, and I am an assistant professor and co-director of the Health Law and Policy Institute at the University of Houston Law Center.
Excellent. So on Wednesday, a grand jury declined to indict Dr. Hassan Gokul on the charge of mishandling and stealing the COVID-19 vaccine by giving it to friends and family. However, a lot of news headlines were saying doctor charged with, but from a legal perspective, can you break down this case for us?
Sure. I'm sure we'll get a little bit more into the facts of the case in a bit, but after the hospital became aware that he had distributed these excess vaccines outside of the hospital setting, he was terminated. A prosecutor brought a claim against him, which was dismissed early in 2021. And then the district attorney decided to also bring this case in front of a grand jury, which, as you just mentioned, the grand jury, after 2 days of testimony, refused to indict him.
Right. Now, so this case, involving this doctor who was accused of mishandling and stealing the vaccine, people were calling this a unique case. Based on your own research and your legal experience, how is it different? How unique is this case? In other words, and I know it's probably a stretch, but how different is it from, say, taking the food from a restaurant you're a chef at instead of just tossing it and letting it go to waste?
So in the legal sense, this is a rather unique case because it's one of the few that we've actually seen going in front of a judge, going in front of a grand jury, etc. So that in that way, this case is rather unique. The facts of the case, in which Dr. Gokul had six excess, or nine, I believe, excess doses that would go bad and go to waste within 6 hours, and so therefore he distributed them to others, is also probably relatively unique. We're not hearing a lot of those stories, but we also have to remember that this was happening early in the vaccination effort in the United States, and so there was a lot of a lack of clarity and confusion around who should be getting the vaccine, what the rules are within different jurisdictions, within different institutions, within the hospital. And so a lot of folks were really struggling to figure out exactly how to do this in the most equitable and fair and expedient manner. And of course, we can make distinctions between taking food from a restaurant, I think, and these vaccinations. At this point, the pandemic had been going on for almost 2 years by the time that vaccines started to become available. Over 500,000 people had already died from COVID-19 at this point. These are really considered to be life-saving vaccines.
Yeah. And similar to my previous question, Dr. Gokul's attorney, Paul Doyle, said he used his best judgment, or his client rather, used his best judgment to not let the doses go to waste. He started looking at staff members, law enforcement, before he started calling people that were qualified, before he ultimately gave one to his wife, who has chronic health conditions. Now, from a medical ethics perspective, was that, would you advise we're in a similar predicament? And I ask this because we noted in one of our stories related to this case how Houston Methodist Hospital lost power to one of its generators during the winter storm in February, and asked within the 6-hour time frame before it went to waste.
Yeah, so there's a lot to unpack in that question. And so my personal view from medical ethicist perspective, medical ethics perspective, is that he did, from the facts as they've been presented, I do not have a personal relationship with this physician, so I've not spoken to him directly, but from the testimony I've heard, from the facts that I've heard, he really did everything he could to appropriately distribute the vaccine, and in particular to follow the rules as he understood them at his institutional level and at the state level. At the time, rules were constantly changing, of course. They still are as far as vaccine distribution goes. What really struck me about the facts of this case is the lack of transparency and clarity around what the rules were when it came to distribution of the vaccine and what to do if there were excess vaccines. As far as I understand it, there was not a written protocol as to what to do if there were excess vaccines at the time. There was no waiting list, so that if you had an excess vaccine, you could go down that list and contact eligible individuals who were at that time eligible for their first dose of the COVID-19 vaccine. And so as a physician who's taken a sworn duty to protect his patients and do no harm, I believe that he made the decision to do his best and use his best judgment to get the vaccine at least into arms of eligible patients. And the distinction too between Houston Methodist is, from what I also understand with what happened during that storm, was that there was a more transparent policy at the institutional level about how to distribute the vaccines, in contrast to this example where it really seemed like he was kind of on his own.
Yeah, I think that's a fair assessment. You brought up a good point earlier, talking about taking into account the time when this all occurred, because when the vaccines were first getting released to only like a select few, considering the times now, how bad does this case actually sound in our current climate, where people are opting out of getting the vaccine entirely, or in some cases suing their employers if they make it mandatory?
Yeah, it is amazing how much of a difference a couple months can make in terms of these kinds of issues. Back in December and January, there was really almost a run on vaccines. Folks really desperately wanted access, and for good reason. And so, there were a lot of, another case that we heard about at that time was the case out of Wisconsin, where somebody who is in charge of distributing the vaccines, a healthcare worker, destroyed a number of them, thereby limiting access to the vaccine for people who truly needed them. Because at the time, the access to the COVID-19 vaccine was really limited to those who needed it most, by either it was by age credential limits or being due to coexisting comorbidities, et cetera. And so at the time, we really wanted to make sure that we were getting as many shots into as many arms, particularly into the arms of folks who really needed them, who would benefit from them the most, who were most likely to truly suffer or even die if they were to, in fact, get COVID-19 and be infected. And so at the time, this was, I understand why this really captured the imagination of a lot of it, in the interest of so many. But unfortunately, in many ways, it vilified somebody who was really in many ways, sort of the face of the vaccination movement, at least in his institution. And so, we see it now, sort of the distinction between now, we're really trying to reach out to folks who might be on the fence about getting the vaccine, to explain to them the advantages of vaccination, that it's not only going to protect themselves, particularly as we see the Delta variant really kind of taking hold in this country, but also for others who might not have access to the vaccine, perhaps because they're under the age of 12 or because they have some sort of illness that would preclude them from being able to benefit from or even get the vaccine.
Well, and now I'm curious, what would have happened had he just destroyed them or let them go to waste?
It's interesting, the case out of Wisconsin, there was that case really involved an individual who had a moral objection to vaccination and took it upon themselves to destroy the vaccine in order to do, to affect the change or whatever it is that they wanted. That's different, I think, in many ways, right? There's an intent there to deprive others of the vaccine that definitely would not have existed in the Gokul case. In the Gokul case, he really was stuck in between a rock and a hard place. He was stuck between choosing to try to do his best to save more lives, to not waste those excess doses at a time that there was scarcity. And he was, up against that, against, following maybe rules that that weren't entirely clear at the time. But he really was in a really tough place.
Yeah. Well, and so a lot of activists kind of felt the same way, thinking that he was, in a tough position. And some are even saying, some activists that I've spoken to, I've said that he was targeted. And they're citing how he's never had any other issues in the past. But how accurate would these claims be, especially when we look at, how the charges, as you mentioned before, were dropped and a previous judge dismissed the lawsuit before it was brought to a grand jury? Or have we missed anything?
Well, he was also cleared by the medical board in Texas as well. They looked into this as well, and in March they cleared him of all wrongdoing as well. So he is absolutely and should be licensed to practice medicine in the state of Texas. And they essentially said most of what I've sort of covered already, that the rules weren't clear, that there were no written protocols or waiting list, and that he really was using his best medical judgment in the interest of the public health and in the interest of patients.
Yeah. Well, and like you said, the Texas Medical Board cleared this doctor of any wrongdoing, and he has taken some part-time jobs. We confirmed yesterday with him. But because of this, how it's become so well known, he's worried this will ruin his reputation. What kind of legal or ethical or just advice in general would you try to give to him if you could?
Yeah, I mean, my heart goes out to him in that sense, or anybody who's been, falsely accused in these kinds of circumstances, or misunderstood about what actually occurred. He is, I think that, I've heard that he might be pursuing a wrongful termination case against his institution. I think that's very much within his rights to do so. He's unfortunately not the only healthcare provider or public health official that has been prosecuted or who folks have gone after during this pandemic when they are trying to do things to benefit the patients and improve the public health. We've seen so many threats being made to public health officials and healthcare providers throughout the entirety of this pandemic. That's been an incredible concern for for keeping folks that really do care about the public health and really do care about patient well-being in the field, in continuing keeping them practicing and doing the good work that they're doing.
Yeah. Was there anything else you'd like to add before we conclude?
No, I think that's everything. Thank you.
Thank you. All right, I'm going to hit stop recording.